Hi guys! I was thinking of a good topic to be discussed, and so I thought of exploring the Australian nurse career pathway and their roles and responsibilities. I am Jackie, a nurse by trade for 15 years, from 2007 batch from the Philippines and migrated in here in 2014. So we'll talk more about this after the intro. Stay tuned. Hi guys, I'm Jackie and welcome to my YouTube channel. Before we get started, please don't forget to hit subscribe button and the bell button to get an update with new videos uploaded in my channel. And please like, comment, and share. These are the obvious career pathway. Some may be familiar with you guys because it may be termed similarly in other places or in countries, but essentially the scope are all just the same. So the first one is the AIN or the Assistant in Nursing. Majority of you can find them working in an HCA setting. Some wards they have them as well, but not as many as aged care facility does. The salary increases every year as well up to the 5th year ceiling, or maybe depending on the state award and the facility. The next one is the enrolled nurses. Their salary is also increasing up at a certain ceiling, and I think it's up to 5 years. And if you're tired getting stuck on that salary, then you might opt to get promoted to a registered nurse. Now, with nurses' salary, it increases every year up to a ceiling as per the state where they live. I'll discuss as well that later. But you can get promoted anytime to this position below. First is the CNS, Clinical Nurse Specialist, the CNE, the CNC, the Nurse Unit Manager. There is also additional positions such as the after hours NAP, who runs the hospital after 5 p.m. to 8 a.m. They are consulted for admissions, staffing issues, procurement of drugs when pharmacy is closed because pharmacy in here is not always open. It's not open for the rest 24 hours. And the last one is the Nurse Practitioner. They are almost equal to the doctor. They do assessment, diagnosis, and prescribe medications as per their limitations. And also they do coordination of care and make referrals. Now we're going to discuss their job and responsibilities, including but not limited to patient meals served. They are also positioning the tables, cutting up their fruits, opening the packages, feeding, refilling their jugs, making teas. Next one is with their activities of daily living. They're also helping with showering, oral hygiene such as brushing their teeth and cleaning their dentures, grooming their patients, skin checks of skin tears, but sometimes they can also have pressure ulcers and wounds. They also do help with the shaving, hair and nail care, and washing faces. When it comes to the patient mobility, they need to observe the manual handling procedure, transferring patient from bed to chair, and repositioning patients, and also applying the TED stockings. They also assist in toileting the patient. When they are asking for bed-bound urinal, they provide them and help them with the positioning and catheter care, emptying of it, also specimen collection and pad changes. So they also help with answering the call bells, assisting with phone call, and with that they have to monitor that they're doing the infection control, they're doing the 5 moments of hand hygiene, keeping the pants room clean, refilling the stocks and treatment room, and also the linen room. Generally, they also help with bed making, escorting the patients, especially those who want to go out for a smurf. Also, they do special for confused and wandering and aggressive patient. As I said, they can do the swab collection for sputum, swab, feces, and urine. They can also do documentation by, for example, when they're taking the vital signs, they have to record it in the bedside notes, and also when they're collecting urine or just emptying the catheter, they should also put the input and output data. Also, okay, so we're back. When it comes to also reporting, did you answer patients' concern and also report complaints, report incidents when there is an injury and aggression, also report when there was a wandering patient or they are missing, and also if there is a conflict between staff and or relatives or patients. Lastly, for COVID-19, their related task was just making sure they're doing PPE donning and doffing when when they are going inside the patient's room, and also do screening of patient and visitors. They do the rat test as well. Alright, so with enrolled nurses, you need to do a certificate 4 or a diploma in nursing. So with certificate 4, you cannot administer drugs, and if you finish the diploma, you can administer drugs, but this can be dependent on the hospital's policy. So an EN usually works with an RN to provide patients with basic nursing care, but do less complex procedure than RN. So they can't change any peak dressings or access central lines. It's just because it's close to the heart and it's a complex procedure. Also, they're limited to some extent that they cannot be an in charge in a ward even if they were a senior or they've been working there for so many years, and they cannot even shadow a new grad nurse. They can administer as for drugs. These are prescription only meds. They are sedations and like midazolam, diazepam, lorazepam, with anything with ending with pump and including tramadol. Lastly, for acid drug, they can check as a second checker, but they cannot administer it. With acid drugs, these are all drugs of addiction, and you can see it as morphine, endone, hydromorphone, targin, and mescaline, amphetamine. So as you can see, it means that they cannot even bring with them the keys for the S4 and S8 drugs. Alright, so how to become a registered nurse in Australia. If you are already in here, you need to finish the 3 years Bachelor of Science in Nursing. If you're an overseas nurse, you need to do some pathway. As at the moment, there's an offering of an OBA or outcome-based assessment. This is good for those who's done their Bachelor of Science in Nursing and they are already a board passer. So if you're coming from the Philippines, you should have finished or passed the Philippine Nursing Licensure Examination. You should make sure also that you have an English score and a work experience. So with the self-check, you'll probably spend $410 in that. So just go with the AFRA website. Some countries, they have a different pathway as well, because for those who finish in first world countries such as New Zealand or America, you have to probably pass the stream A, because there's also stream B or stream C. And then once you have succeeded with the self-check, you can do the orientation regarding Australia. There should be an online thing. So you can now do your portfolio. So with the step 3, you need to provide documentation as well with that. And if you have already passed the NCLEX exam, then may have it ready. And if not, then you might need to proceed to step 4, where AFRA would suggest for you to go on the MCQ stage, where they would refer you to give you that APT, which if you register on that would cost around $220. And then when you're ready and you feel like you can take the examination already, you have to just pay the $177 to take the NCLEX exam. So with the NCLEX, it's about 75 to 265 questions for 6 hours. There's a testing site there in the Philippines in Makati via the Pearson View. The test comprised of which is 75 again to 265, sorry. But when it comes to my story, I took mine in 2008 after passing the local board exam, and my computer luckily shut down at 75. So once you score a high and once it's satisfied with how you go with the questionnaires, the computer will stop asking the question. It can happen also in the opposite way. So it's either you pass or you fail. With me, my at the time, what I did is I read the Saunders book cover to cover, and I practiced on that and practice on answering the question at least 3 to 500 questions per day, and I did pass, which is really good. So with OSCE, which is the Objective Structural Clinical Examination, you could view yourself doing a written clinical demonstration of, for example, a clinical hygiene, drug calculation, aseptic non-technique, sharp safety disposal, medication administration, patient identification, and intravenous therapy, and so on. So this test is only conducted in Adelaide, and you need to pay for $4,000. Now the step 6 is when you pass the OSC exam, you can do the registration with APRA, and hence saying congratulations, you can now have it registered at last. And just make sure that you have indemnity insurance, which you can get when you join a nursing association such as the ANMF or the Australian Nursing and Midwifery Education. Also get a criminal check, and the English test score should be ready. You should have an overall 7 score and a score of 7.0 in each band, which is the writing, speaking, listening, and writing part. Moving forward, so this is the other pathway to become a nurse as well here in Australia. I forgot to mention that with 2 years Bachelor of Nursing, it might incur a $37,000 per year, but if you want to shorten it, you can apply for RPL, which is the recognition of prior learning. This scenario is only applicable for those people who has not yet taken the Bachelor of Nursing, or those people who has not yet taken the local board exam yet. Take note that when you're applying for the recognition of prior of learning, that all subjects taken are not recognized here in Australia, but if it cuts down to your time studying 1 year or more than that, then that's really good. You can apply for RPL and reach out to the school administration, and they will surely guide you. So with OPA pathway, it might cost you around $20,000 because of these expenses. If you want to try this out, then you can go back to my other slides and discuss the OPA pathway briefly. Reconversion program, these are all applicable for RN who has finished their degree and have work experience and have license in their country. This is applicable to you if you don't want to take the TVU's OPA pathway, and you may get 2 years RPL for that. Hence, you only have to take this for 1 year, and it will cost you around $30,000. The last one is the Masters of Nursing or Nursing of Practice, or you just have to look at it. Is it either graduate entry or is it for registration? And if this Masters of Nursing can lead you to a registration here as an RN here in Australia. So this is applicable to any person who has finished Bachelor of Science. It doesn't necessarily to be a nursing degree, but anything with a Bachelor of Science in it, to apply to the school, they might take you in and you'll be able to get to study Master of Nursing. And these are all applicable to people who want to change their career. So let's just do a bit of brainstorming, guys, because probably everyone will be like wanting to do a RPL application. But it's just that with doing that, you have to consider that there are so many subjects that are offered in the Philippines, and it's not that essential when it comes to the nursing subjects that are offered here in Australia. So, for example, there are extra subjects such as algebra, physics, or chemistry that was still a mandatory for me to take when I was still a nursing student. In here, I don't think it's part of it. When it comes to the cultural setting, we're still having the Filipino classes, the result classes, Philippine history, and even about philosophy and arts. English classes, just because in here it's their mother tongue, then they don't think it's essential that it's part of their classes. However, they do when it comes to um, making more about communicating with patients and how to deal with difficult questions and all. With Filipinos, maybe it's probably more thorough on how grammars are and speech, I think. But in here, get to become fluent anyway because you get to practice it. In the Philippines, you don't get to practice it anyway. And for the recreation programs, in the Philippines, there's still like some physical education classes that are about volleyball, gymnastics. I think swimming part is essential to that, but yeah, that's the reason why there are RPLs in here. That is just limited. Anyway. So this is the total number of hours that an RN must work in order to get the incremental rates. Each state has their own ceiling. In my experience in NSW, it's only up to year 8. I'm not there anymore. I'm here already in Northern Territory, and their RNs are up to year 7, and they are under N2 level. So if you're planning to work here in Darwin or Northern Territory, I might as well in the future discuss this topic, because when it came here in Northern Territory, I was like keep on searching what am I gonna be like, what level would be I with, if like for example if I'm going to apply for a job, then what level should I be. If I want to get promoted instantly, then what position should I aim for? Right, so tips for me, guys: if you want to skip the normal increments of hours aside from this promotion, take an overtime, part-time, or casual work elsewhere. Why? Because you can get that hours included in your working experience. Hence, you are jumping the queue. Although it can be tiring because of course you get to work a lot of hours, like instead of just working for 70 or 80 hours per quarter, you'll be working probably 100 hours. But I think it's worth it. You're still young and you probably have that lots of stamina to do this trick, and then why not take the advantage of being young, having less commitment, or also when you get to the point it might be a slow progress to advance your career. So if you want to earn more money as well, might as well do that. So as I said, if you don't want to be just a registered nurse up to that ceiling, you can be promoted to a clinical nurse specialist, especially if you are taking that leadership role, if you're a senior member of the team and just taking that in-charge roles. You have more than 3 years of experience, you're very active in many 10% unit education, taking postgraduate certificate, diploma, or masters, and go into a quality improvement projects. So if you want to be promoted, then you need to make a CNS portfolio, and then just talk to your manager if you can be promoted to that position. Because if you haven't met the criteria, then your manager will probably suggest you to do things such as a quality project, which is just fairly easy to do. And for example, in New South Wales, the pay increase is really good, but it only increased for first year, and some state they even increase up to 2 or 3 years. It depends on state. In here, Northern Territory, the increase is up to 3 years actually. So Just a quick note, guys, if you are from a private hospital or a public hospital and then you transfer to a different facility, they call this one as a personal training, so you might lose the CNS status, especially if you're transferring to another specialty. And yes, if you're tired of just being stuck to CNS1, you can be promoted to a CNS2, but mind you, this is an appointed role, so if they would advertise for this position, so you should apply for it if you feel like you are qualified for this position. So they do autonomy of decision making, they do exercise professional knowledge and judgment in providing complex care requiring advanced skills, and undertakes one of the following roles, which is for example, if they are in a specialist clinical area such as palliative care, oncology, ICU, diabetes, they do provide a leadership roles in this practice, and they develop education resources for patients as well, and they also do coordination care of patient, and in the absence of NUM or nurse unit manager, they can be the acting NUM. So we also have a clinical nurse educator. They facilitate in the clinical teaching and learning, utilizing communication and advanced professional practice, knowledge and skills. They support and orient new staff in their new roles, provides educational opportunities, and they are also encouraged to use new stuff to make even a new education series. With clinical nurse consultant, which is what we call in short CNC, they promote continuity of care. So mostly you see them coordinating cares that are beyond the walls of the hospital. So you see them arranging imaging or labs in a timely manner, refer patients to specialists such as the palliative dietitians, doctors, occupational and physiotherapy, which promotes the overall health well-being of the patient. Alright, there are also nurse unit manager. They are the one who coordinates staffing rosters to ensure adequate nursing care is available to all patients. They also do recruit new staff, managing budgets to ensure adequate funding for the team, managing and evaluating nursing staff to provide development feedback and plan career progression. And the last one is nurse practitioners. Their role is including comprehensive clinical assessment, requesting diagnostic investigations, prescribing medications or therapies within their scope, and includes direct referral of patients to and from other healthcare professionals. So this person really needs to do another set of studying, Master of Nurse Practitioner, I think. Um, this is the end of my discussion. I think it's been like a 23 minutes long discussion, and I hope I did not bore you guys. But if you are interested to learn more about the level of payment that nurses receive per state, then that's going to be another discussion for me, which I will try and cover, and also discuss how I become a nurse here in Australia and what was my timeline, like all the visa that I had to apply. And see you in the next video. Bye.